Hello. In this video, I am going to go through the nurse training for SASH out of hours, hospital out of hours. So on the 24th of February, we are introducing a new non-urgent medical task requesting process for medical, surgical and gynae ward areas in the Trust. This functionality will provide a single solution for clinical task management for staff at night and weekends and will replace secondary software held away from the electronic patient record, as well as providing a requesting pathway away from bleeps for non-critical tasks. So, as you can see, we are in a patient record at the moment, and I'm just going to show you where to access the task request form. So we are currently in nurse and patient handover, and within the form section, you can see the task form is there. If you're used to using the manage nursing inpatient, again, go to the form section and you can see at the bottom, the SASH out of hours task request. It is also available in ad hoc, in alphabetical order at the bottom, task out of hours task request. But I am going to go back to my nursing handover page and click on the task to then raise a task. So the first thing you will see is our disclaimer. So as I just mentioned, this is for non-urgent tasks only. If your patient, you need feeling into medical, if there's cardiac arrest, a massive blood loss, stroke or chest pain, still call 4-2s like you do now. But if you feel like your patient is deteriorating, if you, for example, suspect sepsis or has a higher new news score, as you can read here, please bleep your on-call doctor. Then this form should only be completed for needed medical tasks between 5 p.m. and 9 a.m. during the week and 24 hours at weekends and bank holidays. And we would like you to confirm that your patient isn't deteriorating, you're happy that you are requesting a non-critical task and your patient does not need an urgent intervention. So click on yes. And you can confirm that actually you've talked to the nurse in charge of the ward as well. For example, the nurse in charge may be able to find you an alternative solution to this. So we're asking you to put your nurse in charge name within that. And when you've filled all that out, please go to the next section in the task. So you can see that the first question is that look at you requesting a task for your doctor, and the doctor you will pick on this like you would do normally is the team your patient is been looked after. For example, if they're a medical patient, you will pick one of the medical options. If your patient is an orthopedic patient, you will pick the orthopedic doctor. This is not for referring. This is just for a task that needs to be carried out by the patient's home team. So I'm going to click on medical ward doctor for this. I want to put my contact number in just in case they need to contact me. And also they've got ideas of what tasks you want to do. So we have amalgamated all the common tasks that you normally would ask for at night. You can put other in if you need to, but I'm going to put that prescribe fluid and drug within there. And then we have our urgency field. Now we're asking people to be sensible about this, that actually we know that our doctors are busy on nights and only use within 1 hour if you feel like it's needed. So look at your patient. Obviously, if you are worried about your patient at all, the bleep system is still there for you to use, but just think when this task needs to be completed by. So I'm going to put within 4 hours for this task. You can see there's other sections here that you don't have to fill in, and because, as we mentioned before, this is going to be used by nursing and medical staff to raise requests, the medical staff are going to be using this for their handover or to put the scheduled tasks for the weekend if they want a member of their team to see a patient on the Saturday and Sunday, for example, and they can do that by putting specific time and date in here, and if they need multiple visits. But we are just going to do it for the shift tasks. At the bottom, we have got an S-bar, which you'll all be familiar with. Now, normally an S-bar is for critical tasks, and it's normally a phone call based. So you can see the language in this S-bar is a little bit different to what you're used to. And what we're asking you to do is to put information in there, the situation, the background, my assessment, and the recommendation and the request of what your patient needs. And you can put some information in here, and this mimics the conversation you would normally have on a bleep when a doctor has rang you back once you've bleeped them. But as this is a test and a demo, I'm going to put just very, very quickly fill out these forms. And then, as always, when you want to save your form, you click on the green tick. And once you've clicked on the green tick, this will automatically send your tasks to your chosen doctor's work list. So as you can see, we're now back in the patient's record. But what we want to do now is look at what tasks you've got for your ward and any updates for those tasks that you've requested. So you can do that by clicking in Patient Focus Board. And you can see the list of your patients. This will be your ward list here. You've got the location of your patients, any latest EWS scores in here. And you can see with the current task what tasks you have requested for your doctors, and you can see who it's been requested by, what request it is, and how many hours you've asked for it to be within. And then also, if there's any handover tasks between doctor and doctor, you'll be able to see that within the scheduled task column here for the weekends. But what I'd like to show you is the updates column. So once your doctor has seen the task, what we've asked them to do so that you're not having to bleep them to ask for an update is that we want them to put a comment in the updates box just to let you know what's happening. So they may ask you to say that you've seen the task, absolutely fine. They may tell you they'll give you an ETA or where the approximate will be able to be with you for, or they may ask you to do a task before they come. So can you please complete a full set of obs, maybe do an ECG, for example, before you go. And these updates are form-based, so these will be part of the patient record. So, but what's quite nice about this is that you can also answer or put an update in yourself. So, for example, if I were to click into the box, click on Open Form, you can type in here if there is an issue. So, for example, I've requested this task 4 hours ago. Can I please have an update? And so this is instead of having to bleep them again a number of times. And what is nice about this is that once you have green ticked this will become part of the patient record. This will be documented in your patient record that you have escalated this. So I'm going to stop recording now. And what I would ask you to do is just be aware, continue to refresh to get any new tasks on here or any new updates if when you look at this work list. And again, this work list should appear on your patient focus board, but if it doesn't, click on the plus and you can add it by clicking onto it at the bottom. If you have any more questions, please contact the digital team. And again, this is going live on the 24th of February. Many thanks.